This call is now being recorded.
I'm doing this course because I wanted to just add a qualification, or I was not getting into somewhere else, or some other reasons. You can leave all reasons behind. There are issues, there are reasons everyone has. But when you are into this course, please put your 100%, because after this, you are going to carry the name of a specialty which is as big as hospital administration. And it is our duty that we will try and give you the right direction and the technical competence and skill building. But eventually, it is you who has to put your best foot towards this direction. This is just to give a beginning, because I happen to be evaluating one of the subjects which came to me, and the input which would have been put by the students, I think it is much more which is required, which needs to be, because when we come out, the environment is not going to accept a person who has anything less than perfection in the field where you're going to perform. And you will be the end point. If the question is asked, or you are the person given a responsibility, manage and operationalize the ICU which is there, and you don't know the basics of the zoning of an ICU and staffing of an ICU and equipping of an ICU, that is the day where it gets over simultaneously. So it is very important that please keep yourself, at least for this period of the course, alive and give your 100%. It is for your good in the long run. And before I begin, I will be talking on hospital as an organization. So we'll talk a very basic level today. And how does a hospital function? What are the challenges which we face? What are the roles, responsibilities we as administrators in the hospitals, which we should have, what we should try and avoid, both theoretically and try and give you practical inputs as well to the whole thing. However, if you would have understood that today it is a legal requirement to have hospital administrators. Very recently, the law has been taken out where it is said that the hospitals will be managed by hospital administrators, not by non-hospital administrators. Now, that means that there is a some cutting edge which is there amongst the people who are from this background. And as recently as the government has taken out this mandate, that this will be there, and it reads very clearly: health departments to hire 150 hospital managers across government health hubs. This is a Times news, and it is figured, and this has come from Ranchi. So government is now understanding and asking for requirements to match their hospitals akin to the corporate or a private hospitals. And they will play a pivotal role in streamlining hospital processes, ensuring patient flow and movement. They arrive improving coordination amongst departments and maintaining the availability of medicines and equipments. Now you see, a basic department can function, but you are going to run the hospitals. It's not one department of accident emergency or an ICU. So the holistic knowledge is very important. And that is where the hospital managers will play a very important role, which are you all, which will be undergoing this. And with so many schemes like Ayushman Bharat and other things which are coming in, this becomes very important. So uh, it's not just a job, it's not just a, place where you will be employed, but it's a way of life. It is somewhere that expectations will be very high from the beginning, and from the relatives, from the patients, from the staff, from your colleagues, from your uh, governance, that is your top management, and from every person who enters a hospital, they look up to a hospital administrator to run the show. So that is where we stand. So why I give this background, because you should feel pride in why we are here and why we are doing this, rather than thinking it otherwise. And technically, I'm giving you evidence that there's a legal mandate, as well as the government which is now incorporating and hiring hospital managers in the government setups. So that means they want to match the care providing uh, at par with the corporates. So that is very
Sandeep
good.
sir, can I just ask a question, sir?
Sir.
Is this applicable to private and corporate hospitals also?
The private and corporates were already having, sir. They have
No, no, no. At least in Ranchi itself, there is a hospital, a big corporate hospital being managed by a MBA person. He is not a doctor. So that's why I'm asking you.
No, here I'm just talking first as a hospital administrator, sir. So
Yeah.
I am going to come down to the second part of it. I really don't know. I don't have a profile of the course while we are all here. How many of you are from the medical background?
But I remember, sir, there was a Harvard study which had said that who will be a better manager, whether a person having only administrative knowledge or one with having those clinical as well as the administrative knowledge. And ultimately, they summarize that no, if the person is having both of it, like a doctor is having the administrator's role, they will be doing much better compared to having person with only administrative knowledge.
So the perfectly fine, sir. That is exactly what I am trying to build up. That first, I am coming down to a person having hospital administration knowledge, a person having, rather than I have gone to we go for this NABH hospital assessments. There are hospitals which are trying to be run through the MBAs from finance and from the corporate side, which are at the helm of affairs. They say because hospital administration is to be done by an MBA, let's say, who come from the IIM or IIT, it's nothing different. So this is also what is a thought process. But why this? At least I'm happy that people who are attending this course will cross that line and will be specific in their field. They will be trained in MBA in hospital administration and will understand in hospital organization and functioning far better than those who have not come through this portal. Now comes the second part, which sir was trying to say. A clinical versus a non-clinical, a person who has worked in a hospital versus a person who has not worked, coming on to the roles where we are performing. Yes, it's a big challenge. There is no ambiguity about it. The persons who are from the background, it is very obvious that they will be able to perform far better than the others. But today we need to understand we have engineers which come out from all colleges across India who's denying that fact that it is the IITians which are the best. They should be there. But then masses or areas to work in bulk are also there, which are done by all other engineers. So if there is a requirement of a hospital administrator, yes, there is an understanding that a hospital operations person, a background knowledge of a medical profession, a clinician, adding on to this, I'm talking about doctor with the hospital administration is a best combination. However, the numbers are limited. When I can tell you, since I am from this profession, it'll be within, it's like you have to run the show in all places across pan India. So that means even if we are, there's a best and there is the bulk, so be it. We need that also. So what I'm trying to say is, don't feel disheartened that you are not from the medical background, absolutely, and then it becomes difficult to understand hospital. But in this period of time, what I'm trying to say for this 1 or 2 years or the initial setting up, you cannot not get into this side and then think that I'll just pass my theory and come out. Otherwise, no hospital will employ you. They will first look forward to the background. They will second think towards the qualification. They will third see the experience. At least amongst these, the boxes needs to be ticked upon. So point is valid that we need hospital administrators with a medical background. However, there is also scope for people who are not from the medical background and who are also part of undergoing such kind of courses because the volumes are required now. That is the need. So anyone who's not from a medical background wants to add anything? What background are you from, Shalini?
Sir, good evening, sir. Sir, actually, I am from non-medical background. So I was thinking that the procedures and the handling of the hospital, the management part, and all those things, I think non-medical students, professionals can also manage all those things.
Okay, so you are basically from non-medical. What is your background?
Sir, actually, I have a very wide variety of background because I was basically from fashion designing, then I did my MBA in education, then I'm doing this course. So whatever way, like destiny showed me, and I was moving into that. But I think that in all the phases and all the learning years, I have learned a lot, and every part of learning is like benefiting me in every
So,
phase of
Samir
my
sir,
life.
I can add that Salini is a very good learner. She keeps interacting with me and taking cues about something. She is from Belgaum, Karnataka. So the most of the candidates, they keep interacting with me from all over India, from north to south, east to west. And whatever best I can do, I am advising them.
No, that's nice, sir. My point why I asked Shalini was why when we are discussing about two facets, hospital administration, one
Yes,
is
sir.
by profession, by where we are, and one is now we have opted to why we are getting into it. And the
Yes.
thought process, do you think when you can acquire qualification, do you think you will be able to perform the duties of a hospital administrator on ground as well?
Sir, yes, because I was working actually in hospital and the academic wing of it, and then from actually I was teaching those subjects, management subjects, which I learned in MA in education.
Great.
So while teaching those subjects, I was involved in those things also. But then I thought that I should have some proper qualification. But
Qualification.
sir, management is one thing that it should be in the attitude that if you will start managing, then and after learning, after so much of learning from you people and all everything, the academic process, we can manage. I can manage
Okay,
meaning.
fair enough. Anyone else who wants to add anything? So my sessions will be interactive. You cannot sleep or you cannot go off by your names are in front of me. I keep seeing simultaneously. So I can see Geeta is there. Anything you want to add, Geeta? Okay. Vishnu.
Hello, I
So,
am Dr. Vishnu from Hyderabad.
hi, Dr. Vishnu.
Yes, sir. Hi,
What's
sir.
your background,
I am a 73-year-old.
sir?
My MBBS is more than 50 years old.
Sir,
Basically, I'm a pulmonologist, worked most of the time for the public health. In the meantime, I worked like a medical officer from the ground level to district medical officer and state director also. After retiring from the service in 2012, I joined international NGOs LEPRA for about 3 years. Then I worked for DFIT, Domain Foundation Trust, Belgium.
very nice, sir.
One, uh,
Very good to see you.
and in around 2008, I did my PG DHHM. Out of with the stimulation created at that time, again I joined in this course, sir.
This is exactly the passion which the people should carry what you are showing to others. I am sure a lot of people will get motivated by your experience which you have and the passion to have and a drive to undergo such courses at this stage. Thank you so much, sir.
Thank you, sir.
And Vandana Patel, do you want to add something? So trust me, this is simultaneously your attendance also, okay? Okay, that's on the lighter side. So this is the background I thought we will start. So before we move ahead, my focus to begin with will be from people who are not undergone such courses or who have not been in very deep rooted in the hospitals. So my request to those experienced ones to be as advisors while we are discussing. However, let those people who have not been in the spheres come up so that they have a better understanding by the time we finish our sessions. So first and foremost, we will undergo this kind of a learning while we end this session today. We will have understood the complexity of a hospital, the role a hospital has in various places, and also the clinical and administrative functioning. Are there any regulatory or legal requirements? I request others to switch off their mics, please. legal and regulatory compliance, and also then we see the leadership as part of the hospital managers and administrators, what we should have. There's a word which we use as a matrix organization as a hospital. We'll see what it is. So this is primarily covering your unit 2 and unit 4, those two places from where I tried to put some words and make a presentation out of it. So with this background, I want to ask you people, do you think hospital, like Shalini said in the beginning, since she has worked in places, it is possible to work here? There are institutions like education, there are places like factories, there are industrial hubs, so are there hospitals. Why are they different? Are they different? If they're different, what is the difference? And if you feel there is no difference, and that's why we since I have done my masters of business administration in leadership or strategy or in finance, so can I also run a hospital setting. So do you feel, is there a difference? Anyone?
So can I have a go, sir?
Sir, I would want people who are not so experienced to answer. That's why I want others to also come up. I will
Okay, sir.
request you
Okay,
to
sir.
sum up so that these all other students also get a chance to speak up. And you will all have to speak. So our administrator is the one who voices his opinion. He cannot be shy, he cannot be quiet, and he cannot be pushed to a corner. That means you're not worth your salt. So if that be so with the background, I would like all of you to be voicing your opinions and coming out with things and speaking and talking whatever you feel, right, wrong, nobody knows. Everyone feels that I am right, so be it. So please express yourselves. So
Sir, may
anyone?
I?
Yes, please.
Sir, I think that of course difference is there as the profession is there, as the sensitivity of the profession and the situations are there, and we can very much understand the minute things, and we can proceed by that, by those learnings, and
So
of course the
so
everyday experience will also add in that.
so first and foremost, do you think hospital is a simple organization or a complex organization?
No, sir, it's a very complex because lives are on the stake, and then emotional, and then financial, then everything is of patient is in the center. So it's very sensitive, sir. I think among many of the and all of the professions, hospital I think is very sensitive.
Okay. So you say that it is a, complex place. Anyone
Yes.
wants to add anything else apart from Shalini?
Do you want me to speak few lines, sir?
Sir, hospital is a place where people's life is on stake. I mean, other institution, it may be product oriented or not directly affecting the life of a people, daily activities of a people.
Okay.
But if person is coming to a hospital, that is definite that he or she is in some pain, injury, or misery, and that means something is not normal in their life.
Okay.
So
So that is why they
hospital,
are coming. That was Shivangi's point of view.
yes, sir.
Anything from Pavan Shukla, Megha?
A lot of departments get involved.
Pavan is also an army officer, sir. He's a Colonel Pavan Sukla. Pavan, this is the time you can interact with sir. Otherwise, it's very difficult.
Sir, I would like to add hospital is not concerned to only patients but surroundings also.
Okay.
Because if many biomedical waste and many waste are generated and that should be disposed and not in the open surrounding. So hospital should take care of each every aspect, not only patient but the surrounding should be clean, like it don't infect other people's surrounding area, infection is not spread, they
Okay.
don't get infection. So likewise it is a very complex and it has to take care of all everything.
Fine. I got your point. Very nicely brought out. Anyone else?
Hi, sir. This is Dr. Madhusri here.
Yeah, Madhu.
Hospital is definitely a complex organization. So I would like to start with once a person or a patient walks in, so there are a lot of different departments which is involved. So first and foremost, the security. So first, he will arrange where the patient will go to. He'll arrange for a proper, so that they enter easily, whether it is the emergency department, whether it is the OPD, they direct the patient inwards. So that is one point. And then after that, they go to the reception. And then after that, the patient is directed to the OPD. So in that OPD, there are different OPD. There is a receptionist who is sitting over there. And then they go to the billing department. They go to the doctor. And after that, they go to the laboratory services, radiology services. In the meanwhile, they talk to the PRO as well. So it is basically a complex organization wherein different department, being medical, non-medical, billing, financial, everything is involved. So it is not only just the doctors, as somebody mentioned, infection control, definitely that if there is any procedure or anything involved. So this, I'm only talking for a patient who walks in for an OPD. So when somebody comes in for emergency, there is a lot of different departments which is involved, be it
So
counseling.
if I summarize in one line, there are cross-functional teams, and there is multiple areas which interact with one interface, that is patient, simultaneously, right?
Yeah, true.
Okay.
Yes.
So one, we discussed about life-threatening. Second, you talked about multiple domains or multiple departments which are interacting with this kind of a setup. And as a system, coherently moving from one to another. There is no organized, it's such an organized, if I can put it in the word, there's organized organization or an organized chaos which we are handling at a continuous backend. Yes, anyone else? Nidhi Solanki, Abhishek Chaube, Datta Kamble. Where are these guys? Are they online and gone off or what? I'm sure the people doing recording should also monitor that part. And Dr. Munmun Kole. So guys, if you don't interact or come out with the inhibitions, that will remain inside. That is what will be an issue. So like these people have talked about, they have brought certain areas. I'm sure others also have something in the mind. Anyone wants to add anything? Yes, please. Shweta, whose mic is on? Abhishek Chaube, your mic is on. Either you speak up
Yes.
or you can switch off.
Hello. Yes, sir.
Yes, please.
Actually, sir, before some minutes, I had joined this meeting.
Okay.
Yeah, that's why. What are you asking?
I am asking, you're from, what is your background, Abhishek?
I am completed my master's in commerce.
Okay.
After that, I am currently designated as a quality manager in hospital and working in hospital from last 7 years.
Okay. So do you think hospital is a complex organization?
Yes.
Why do you say so?
Because we are treating a human being.
Okay.
Hello. Because we are.
Okay. Anyone else?
So may I?
Yeah, please, Munmun.
So hospital is a complex organization because we not only take care the patient in our OPDs, IPDs, and emergency services. That is the clinical part. We also have our HR department. We also have our budgeting and man management system, and we have to take care the all the cleaning part and all the equipment buying and their use, their maintenance. So we take care not only the patient or but just like a house. We arrange everything and take care the man and the machine and everything. So it
Okay.
is. I think it is a complex organization.
Fair enough. You brought some points out. So why I'm trying to ask you these questions, the clarity has to come from here. Are we different or are we same as other institutions or industries, or is there I think Madan sir, you wanted to say something?
Yes. I think quite a lot of points has been brought out. But what I like basically The hospital is not only a medical organization, it's a social organization also. So hospital is a medical and social organization. How? Because though we are treating the patients that is inside the hospitals, but there are lot many social activities also goes together. Like we are having this outreach programs where we are having screenings, we are having some you mean sessions where we are talking to the mass and people about the prevent. It is not only the you mean curative parts what we are doing in the hospitals, but we are doing the preventive part, prophylactic part, rehabilitative rehabilitative parts also. So it's the prophylactic, preventive, curative, rehabilitative parts what the hospital is playing. And it is playing a big role with the social organizations also. So we are not limited to the hospitals within the boundaries, but lot many hospitals are doing the outreach programs where they are going to do, like tell I was a director for some time back to the cancer hospitals. In fact, every day the team goes to different districts of the Jharkhand, where they are conducting the screening programs for NCD, non-communicable diseases. That is the basic oral breast and cervical cancer, as well as the hypertension and diabetes. So non-communicable diseases, they are going screening and making people aware. And in fact, there is a, you mean, sessions where the community health officers, which are the actually nurses posted over there, the health and wellness centers, they are being educated to conduct the further, because the team cannot go all the times to same place. So it is education of the CHOs also. That's the part of the hospitals. They are conducting it.
Okay.
Similarly, so these are the things I can whatever I remember, sir. I told you.
Perfectly fine. So we all now by now agree that it is definitely a complex organization. It is not as simple. Now I'll give you a background. You understand car manufacturing or industry of that kind. It's functioning for a few hours. It is a process line. There is a similar kind of activity happening that is grouped together, and eventually the processes are mapped and you have an outcome which is coming as a car. Here is an organization which is supposed to function 24 into 7 into 365. Not a minute less than that can a hospital be shut down. Meaning so that at that pace, when you're working for 24 hours into 7 days into 365, at one end, your hospital has to be up and about in every process, in every equipment, in every staff, in any material requirement or in the care component all the time. There is no dead time, or there is no maintenance time, or there is no time in between where I can say कि अभी ये 2 घंटे के लिए my hospital is closed, or I have finished by 5 o'clock, morning it will open at 7 o'clock, like the way industries do. Meaning that it is a functional part which has to be maintained at the highest level round the clock throughout the year. One. Two, at the same pace, it is dealing with life-threatening, life-saving, and human beings. It is not a product which is coming out. It is human lives moving in, human lives moving out. Continuously in different state of mind, body, and soul, where their handling, their care, their criticality, their life-saving component, and simultaneously to add to this, with the one of the patient, there will be minimum 2 to 4 relatives, which will also be of the similar high end on the emotions as well as expectations. So that means we need to perform at all points at that level for this kind of a background. Hospital is an organization which comes together as, if I talked about various places, you will have human resource. Here, it is from a super specialist, which is having the niche, like Abhi sir, the way he said that I'm a pulmonologist, to the last man that is coming together as maybe a technician on ground. Very quickly, they form a cross-functional teams. If an emergency happens, there will be a specialist, there will be a super specialist, there will be a nursing staff, there will be a paramedic. Last to the extent to that that we will have a housekeeper also involved, and the ambulance moving or a driver involved. So you see the cross-functional teams which get integrated together in just as a very short span of time, so as to perform to the common objective, that is life-saving patient care. If I get a disaster which happens, you see the speed by which the entire hospital comes together in one go. So that makes itself a complexity in that organization, that there are cross-functional teams. There are teams which you have to handle from the highest level where they are with the super specialty or the specialist or a high-end clinicians, to the person who's the your class 4 employee, to a housekeeper, to a driver, to all those kind of people. And in between this plethora, the hospital runs. So as an administrator, this becomes a very important area. If this is the background which is understood, the complexity is further added by technology. It changes so fast. The expectations and the perceptions mismatch, which is very evident. Why I'm saying is a mismatch is expectation by whom? Expectation by patient, that you will be providing to me laparoscopic surgery when I come. It's an unsaid norm today. The expectation is from the surgeon that I will get the equipment for which I am supposed to be performing laparoscopic surgery. You're supposed to provide. It is supposed to happen. The expectation by the management that X number of laparoscopic surgeries have to happen, or whatever are the backgrounds, that the volumes which have to come up as in a hospital setting, so as to have optimum level of occupancy and the profitability getting generated simultaneously. So the expectations are phenomenal, and I'm giving you a variety of places for where it originates. It has to match and cull out together in a same place and for the same objective. So with this, all this adding on together, it is definitely an area where technology moves fast. And today, if we don't comply with that same thing, we are definitely going to face difficulties. So that means the knowledge which you are supposed to be having, or I'm supposed to be having, in towards that complexity of the technology within the, let's say, an OT setting which needs to be brought in, it needs to be understood by that dimension of the performance by which it is going to give you returns as well. So that makes it complex. And to add to this complexity in the hospital setting are the legal requirements, which we have to comply with, which we have to be aware of, and which are mandated by law, which cannot be avoided. AHRR guidelines need to be followed, let's say, for example, for our radiological or radiotherapy equipments. PCPNDT Act needs to be followed, which needs to be, I'm sure the gynecologists, I can see one of them is attending right now. So these are norms which we cannot say that we can be avoided or we are not aware of. All this adding together and occupying the space where we are with the patient which is now moving out. Here it is not a car which is going, that numbers are there, 40 cars are produced in 2 days. Here it is an intangible, non-measurable outcome indicator. A good patient going out, a healthy patient going out, a patient getting cured going out. It's a norm, it's expected. So that's a service industry where we are in, that it is not an outcome which could be quantified in numbers. It becomes very difficult. But on the contrary, if that is not qualified in the correct perspective and the care has not been proper, or something has happened, that becomes highlighted very fast. So the outcome is very difficult to quantify, and it's more intangible in a hospital setting as compared to industry, which is giving fixed products which are coming out. So from input to an output, I'll add this point again, one more complexity. From the beginning till the last, the entire process. What you do, you go to a shop or a showroom, you buy a car and come. You do not know in the assembly line behind what was the process involved. Here, the moment he enters the hospital, he, like she said, that he goes to the reception, goes to accident emergency, goes to the department, gets undergo surgery, he is following you in the entire process till the end. He is not the end, but the patient or his relative himself is part of the process which we are doing at all levels. His eyes, ears, and everything are open and is being, so we are under continuous check. That lens is on us, what we are doing. If it is critical, then that period is difficult and it is handled in a different manner by the patient and the relatives. The moment he starts getting better and he's coming to a ward, you will realize that issues of linen laundry, dietary services, and all other starts coming out as well. So each process of ours is under a complex lens or a scan. That means that we have to befit the standard of expectations where it is supposed to be there, and our processes need to be as crystal as clear. All this adds on to make hospital as a complex organization. And lastly, the care component does not start from only a patient coming to a doctor and the getting medicine given in the dispensary. There's a common norm which people have in their mind, those who are not from the medical background. The process starts from preventive, promotive, curative, rehabilitative, every aspect of a patient as far as possible to get to him to see that he gets to the best as far as possible on his own and runs his life the way he was supposed to run. One more part I'll add is the duration. There is no fixed durations in this. Here I know when I'm producing a car in 10-15 days in different processes, it will happen. Here it is ranging from 2 days of hospitalization to almost 40 days of hospitalization, depending on the criticality and the complexity. So all that period, he's going to be availing your services. So all this adds together and makes this organization where we are working as a hospital highly complex. If I rate it, it is the highest and the most complex organization existing on this planet as on date. No other organization can fit into all those criteria which I've just listed. And I'm just talking out of experience here. So I'm sure by now, all of you understand when I say that we are very complex in our functioning. And if we are so complex, that means the understanding of this complexity has to be phenomenally high. If we do not have that and do not relate to it, each and every aspect which I've discussed now, in where a hospital administrator will fit in, he may not be 100%, but his omnipresence will be there in all areas where we have just discussed upon. So if I have a PICU or NICU and I have the equipments or incubators which are coming in, if I don't have the process mapping and an understanding of the functional part of it, if there is a requirement, I will not be able to add on to it. So that means my knowledge of the functioning part, my knowledge of their processes, of their departments, my knowledge of their requirements needs to be added upon. So that means where I stand as an administrator, I should know all this at the background as well. So all this makes us at a very, very challenging areas where we are working. But I'm sure if the challenges are high, so be it. And that's where makes a administrator who is worth his salt come and survive in a place where he's supposed to be and make his hospital as an organization progress ahead. Anyone wants to add anything here, what I've spoken, or any difference of thoughts?
I think you have covered very well, sir.
Fine. So if that be so, then we use the word cause as a social organization. We have a role to play when we are talking as far as the diverse areas where we are coming in together. Most of it we talked about. Integrated workflow. You see, from the clinical staff to the support staff, all needs to get if infection control is a norm in a hospital, is it a mandate only of a support staff or a person who's washing the linen laundry? Is it the responsibility only of the clinician who's operating that he needs to have the highest protocol in place? Isn't it the norm where all integrated together, starting from the washing of hands to the last point where the linen or food or other issues are handled or disposed of? So it's an integration which is very important. The understanding that each role to that extent possible and to coordinate it simultaneously. Multiple activities with multiple workforce of multiple bandwidth of understanding in terms of their backgrounds as well as experience or qualifications need to function together. We have multidisciplinary teams which work together, and that is where makes us a matrix organization. It's not like one boss, one person reporting. So at multiple levels, multiple things are going on. So it is more of cross-functional multidisciplinary teams which are working simultaneously. There are absolute clear lines of authority which flow, and responsibility comes out of that authority for the decisions which have been taken and the implications which are going to be there. So accountability, authority, responsibility is defined clearly. However, the reportings are such that it may be horizontally or vertically, making it a matrix organization. Adding to this by the integrated or a differential workforce which needs to function at the same level of the same understanding, at the same pace with the same outcome. That is how it becomes as a social organization also where we are functional upon. If this is understood, should I move ahead? If anyone has
Yes, sir.
anything, keep telling me, please. Otherwise, I don't want that it's just a one-way traffic. Okay, so if that be so, we are having certain areas in the hospital. If we divide that, a hospital has to be divided into certain functional areas. Can anyone tell me that? Apart from doctors, I want people who are not from the backgrounds, if they can think and tell me what are the departments. Yes, Shweta. Surbhi. Shruti. Shivangi.
Hello, sir. Sir, I am Dr. Shivangi.
Yeah, Shivangi. Okay, you only had if people are now, I think, zoning out in between.
Okay, okay. Sir, there are various functional segregations like clinical services, diagnostic services, support services, utility services, along with support may be subdivided into infection, laboratory, and radiology, various other functions. So, hospital is a coordination of many services along apart from clinical and diagnostic, like biomedical waste management and utility includes linens and other services.
Okay, very nicely, Shivangi has brought out that the first and foremost, the functional segregation, that the combination is the clinical or the patient care areas, where we have that one area which are patient care. Once there are patient care areas, then we said there is something which is called as the support areas, which are like your supporting areas which are going to be functioning to the main function of the clinical or the patient care aspect. They are supporting that function. In that support function, we can have the ancillary services which are also added upon. And the third area is purely not directly, but administrative in nature, where all factors of administration are happening. And the fourth is the technical or the specific area of biomedical engineering, your IT, which is managing things. So these are the technical areas where hospital is functioning. So what are the clinical areas? What are the support areas? We need to have a clear understanding of these. Now, if I have a question to you, what do you think is the dietary services? You should be understanding that it is definitely not direct patient care. So it does not fit into clinical. All these services will fit into the support services. That means it is important towards the hospital operational continuity, which is happening simultaneously all the time, but may not be directly towards the quality of care, which is the primary responsibility of the clinical departments. So all like medicine, surgery, wherever the patients are moving in, or the OTs, they will be the clinical areas. Support will be all other things which are supporting the function of the clinical areas, like your radiology or diagnostics or dietary or laundry or various other services. And third is the administrative areas, where absolutely patient is not directly responsible towards the clinical or support. He's undergoing your HR, legal and finance and so many other things. Now, why I am putting this in these heads, it is very important to understand that the role where R directly will come into places. Clinical services is definitely run by the clinical departments. However, their functioning and relating to their requirements or making them operationalize is also a responsibility. But where comes the support services at the back end? Where how is your electricity flowing? How is your water consumption? How is your heavy equipments towards CSSD and your dietary services? All these are support services where our role will be directly involved in it, so that operations are maintained of hospital. Adding to this, the administrative areas, they are important, and as an administrator you need to have an understanding toward the status where financial management, your manpower requirements and the churn which will happen, apart from the legal compliances, that definitely is a big requirement which we all should be having at all point in time, so that the hospital sustains the functions which is supposed to happen. And last is the technical part of it. Yes, there are technical people who will handle it, but you will be handling the technical people as well. So that is where your requirement towards understanding of these functions become very important. I happened to evaluate one of these papers which came in. So the question was asked on support services, and the people, half the people mixed it up with totally with the departments or the patient entering from the gate till the patient coming in and then getting treated, and then listed everything but the support services. So please do have a clarity and divide this into functional areas when we're talking in the hospital settings. It is not just a patient moving from one part to another to the last. So something which are not visible directly in front of your eye are also important areas which are functioning at the back end or the background. For example, mortuary service. You will never get to see directly, or as a patient will never get to see in that manner. But do you think we can compromise the functioning of that department? Or if the body cabinets are not maintained properly, or if the ice or the electrical requirements are not there appropriately, or if the rituals place is not there appropriately. So whatever you think which may not be even in front of the eye becomes equally important. And that is where the support factors are happening and make it relevant towards the continuity of the operations. Clear? Or do you need me to elaborate more on this, the functional areas of the hospital?
Sir, the security services can be included under the support services, sir?
We can do that. That is
another thing. Facilities, I think, requires little bit elaborations, like that engineering departments handling different aspects of the firefighting services or the building management. Now the building management system itself is a very big thing, where you can manage the human temperature, pressure, and those the fire suppression systems, and all those things are now with the advanced hospitals available. So facilities, it's not that like the old hospitals type. Now it is with the newer hospitals coming up, everything is you mean AI managed, and like if something, the fire management system is very now required, where there are smoke detectors and sprinklers. So those sort of engineering services, I think now the engineering services also we get a question on that itself.
It's a very important area. These engineering services are an important facet, and integration and understanding. No, I'm telling you honestly, if you think that at this point that it is only engineers which are going to be doing that job, is fine. But who will question the engineers? They are functioning in my hospital. Are they changing the filters of HEPA bank in my OTs or not? And if yes, what level, what extent, and what quality checks are there? I am supposed to have that knowledge at some end, at least not in 100%, but to question or to check on people which are performing various duties, which are more technical in support or administrative in nature. I know my surgeon will give a cut at the McBurney's point and will take out an appendix. That he will do. But apart from that, there are 24/7 so many other activities. We are all supposed to be seeing that. Now we asked a question very simply: what do you think are the support services? Which department, which of the following is considered as a support service in a hospital? Surgery, outpatient, laboratory service, or intensive care unit? This question had come to you before the class?
Yes, sir. Yes, sir.
So it is laboratory service. So now if you divide this part into various functions and the departments, you will relate to it and why we need to. This is at a very beginning level we are talking about it. But when we get into each and every department, we will realize that why are we talking about it and what will be our role in that. It's a very early class, so I'm not getting too much into those details as of now. But at least for the initial part, have a background understanding that there is different functional aspects, and because of which the departments are grouped together because of the functions they carry, and that is the specialty or the domain where we are supposed to be, and what they carry out and what are the impact which come out of those areas. Right? So we move ahead. So there are two different types of organizational model. One is the functional structure and second is the divisional structure where we have. Function is, we have just seen, the complete nursing, let's say from beginning till end comes under one function. They are supposed to provide nursing care. So that is a function where they are carrying out. Second aspect is the divisional or the departmental function, where it is organized by services or by patient groups. Pediatric group, oncology group, units which they're clubbed together. So basically the groups come together and that is where the patient care is being given. So it is, as the word is, it is tailored specific to the patient-centric requirement. So it is the surgical division which is moved together towards giving a comprehensive surgical care to the patient. Here is on the other side is more on a functional aspects. The departments are grouped together. So it focuses on departmental efficiency, but can create operational silos. They are not part of those departmental or the divisions. So they are only in their isolation. If I say nursing has just one function from beginning to end, and if they function only independently, they may not be aware of what is happening at a cross-functional level. So that is why the functional structure needs to be superimposed with the divisional structure, or the departmental structure, or the group of departments coming together based on the patient-centric care which is being provided. So these are just two different types you have to understand. And here it is more of vertical in nature, the functional structure, and more horizontal in nature will be the divisional structure. Right? So don't get too much perturbed by it. It's just understand these words as of now. You don't have to remember all these things by the end of it. Now we use a word called as matrix organization. What is a matrix organization?
It's the combination of the two, sir.
So,
functional and divisional.
Functional and division. Yes. Anyone else apart from sir who can tell me what it is? And what do you think? Why should we have a matrix structure? Ritu. Rutika. Raman. Rakesh. Rajiv, Kaushik. Anyone?
Jai sir.
From where has this come?
Jai sir, I am Colonel Shukla sir.
How are you?
I am Colonel Med 11. I am fine sir.
Good.
Sir, I am in the office presently sir. Some thing is going on sir.
But Colonel Pavan, it is a Sunday. You are still in the
sir, छोड़ दीजिए sir. In public
छोड़ दीजिए कुछ
काम कर रहे होंगे. So anyone else apart from that?
Sir, matrix organization is organization structure in which employees report to two managers.
Yes.
Functional manager and project manager. That is administrative.
Can give an example of this?
Like the nursing matron.
Okay.
She report the nurses. They report to their head matrons as well as hospital administrators or the divisional heads like HODs or treating
Okay.
physician or surgeon.
Any nursing personnel in the course who's attending wants to add anything?
Yes, sir. Good evening, sir.
Good evening. Who's that?
Yeah, myself Sarita Kaushik.
Yeah, Sarita, please.
Yes, I am nursing officer in Delhi Government Hospital.
Okay.
Sir, in the same way, I am working in administration department.
Mm-hmm.
I have to report to my admin department heads like AMS, DMS. In the same, along with that, I have to report to my ANS. I'm doing duties related to that admin work, but whenever there is shortage, I'll have to do that in clinical areas also. So I'm reporting to both.
Okay. If I take you and give it more a department related example, as a
Ji.
nurse, let's say, for example, functioning in ICU.
Yes, sir.
Do you think an ICU nurse is under a matrix organization or matrix structure? Same way, what you said right now.
Yeah, yes, sir. Yes.
Right? You
Yes.
you as a admin nurse, you go for rounds.
Yes, sir.
You check her functioning in terms of her biomedical waste, her infection control, her linen change or patient care or rehabilitation, physiotherapy hua ki nahi. You're checking so many things when you go on to
Yeah.
nursing
Yes, sir.
care, right?
Ji.
On the same time, that nurse is reporting to you because you are a nurse administrator in the higher
Yeah.
echelon. At
Yes.
the same time, she is reporting to the anesthesiologist who's in charge of the ICU for direct patient care कि भाई वैप प्रोटोकॉल फॉलो हुआ कि नहीं, वेंटिलेटर का क्या सिचुएशन है, पेशेंट को इंजेक्टेबल्स लगे हैं कि नहीं, मास्क चेंज हुआ है कि नहीं, so many things where the clinical part he's directly she's handling and telling him, and here is the nursing part you are checking on that. So one person who's the, let's say, an ICU matron is responsible towards you as an administrative nurse who's sitting in the headquarter or a higher administrative head. On the simultaneously on a horizontal platform, she's reporting to the head of the department of the ICU for the care which is being provided through her.
Yes, sir.
So one technical individual comes under two chains, horizontally and vertically, both by line and by staff. And that is why we say that we are a matrix organization, not a simple structure where one boss and one follower is there, like in many organizations. So it's a dual control simultaneously. Is this point understood by all? Or you want me to elaborate on this?
Sir, I have a question.
Yes.
Sir, is it applicable to the clinicians who are only working in the OPD hours or general physicians in working in any hospital?
This matrix structure is where every hospital has to follow. It has to be on the dual. Now, tell me one thing. What is the advantage or what is the disadvantage? Why we should not have this?
Sir, disadvantage can be it creates confusion sometimes. Who to report first? Maybe.
So imagine that person is challenged. She is handling 12 or 14 patients in the ICU. At the same point in time, there is somebody who comes on her head at odd hours and checks her. That is from the nursing side. And simultaneously, she's been pulled by the clinical staff also that this care is not being provided and that has not been done and this you're supposed to be doing. Have you done this or not? Right? So she's under pressures from two directions. So this is a disadvantage. If this be the disadvantage, should we have a metric structure or we should not have?
Sir, we should have, because it creates some sort of discipline, or maybe at the time of shortage of staff, some staffs are interchanged.
No, you're right. It creates some check. But when you said that she's getting pulled from both the side, do you think we should have a matrix organization? They can report only to the nursing staff, whereas the nursing matron comes and checks from the principal matron or comes and checks the nursing matron of the ICU. Why should she report to the clinical staff in the department? What are your thoughts on this?
So for that, hierarchy should be given properly. Like who should report to whom should be given in a proper way so that this matrix structure won't be a problem to the person.
But you feel this matrix structure is important? Should be there?
Yes, sir, it should be there because when a person is handling both the sides of the hospital, when they are doing both the duties, matrix structure should be there for them.
So very rightly brought it. I'm trying to question you and put things in your mind. Why on one side we understand that the difficulty with the matrix structure is that a person is dual chain of command. Nobody likes to be reporting to multiple bosses. Everyone knows who's the one I'm supposed to be moving up to. But here is questioning from two sides which comes. So that is where the checks and balances happen. This is where the first point which I have written. What are the advantages? It keeps an interdisciplinary collaboration which is happening. A discipline where one is the clinical side and the second discipline is the nursing side. Both at the better ends are checking on to the point where she is delivering a care to the patient. And who's getting benefited in the last is the patient. Also, when a nursing matron will come and check, she will check for various factors and the clinical anesthetist will check optimization of resources, which will happen across in that place because she's functioning there. Dynamic and flexible for complex areas and critical for research. So metric structures are very important structures. We all I've just given an example or somebody gave an example of a nurse. So I took it forward. But every person in the hospital setting is under a line as well as a functional control, is at a horizontal control and at a vertical control. Vertical, if I'm saying, is at a top end, and horizontal is my parallel contemporary to where I'm providing that care component to. So that is where the collaborative team effort comes into place. And that is the importance of a matrix structure which hospitals have got. Are we clear for this? Any
Yes.
additions? Anyone
Yes,
wants
sir.
to?
Yes, sir. Sir, but burnouts should be taken care of.
Yes, I fully agree with you. And when does burnout happen?
Sir, when confusions and dual chain of command.
So what she said was very right in between. I think.
I think, sir, Salini has come out with the Henry Fayol's, which I am remembering, the principles of management, where there is unity of command is there. One employee should get an order from only one boss.
But sir, in hospital settings and matrix organization, that is where we get question towards that it is not one boss or one denominator to which it is coming. It is coming cross-functionally. But
Yes.
what she rightly said in between one line, she said that the reporting channels need to be clarified clearly. That is where the problem happens and the burnouts happen because the person does not know who is the person I'm supposed to be reporting to. So that is where our role comes into place for each employee to make them understand and to give their job descriptions in such a manner that they're clear about it, what they should be doing and whom they should be reporting to. So that even the metric structure becomes a simple structure to function on ground. It is not to trouble, it is not to add agony, it is not to put a person on an edge. It is to facilitate, help, and add on to the care which may have got missed into something by other side, so that eventually the last point which is supposed to be benefited is the patient. Right? So that is why this collaborative effort towards metric structures is there. Any questions here? These are all questions which will be there when you will be facing your exams as well. So understand the concepts behind it. And let me tell you, the presses are very boring. The books which you get to read. Unless you have a background, you may not understand, and it is so monotonous that it gets difficult to comprehend also. So be aware, be awake, and understand these few sessions which we are having. Right? So if that be so, should I move ahead?
Yes, sir.
Yes, sir. So now comes the regulatory frameworks. We are under some regulatory body. There are some examples I've written. So there are some which regulate us. So what is the difference between legal and regulation is? They are cross-checking us simultaneously. Legal is a must. that I need to be under the legal compliance come what may. And hospital as an organization is supposed to function under Clinical Establishments Act. It has to function with that. It has to have the compliance laws in place. It used to, AERB guidelines have to happen. Biomedical waste management rules, which the government has taken, have to be followed. Now these are must. There is no compromise on these areas because you are under legal check. And moment there CPCB norms or any other norm violation which has happened, the management comes into the question mark and there'll be legal implication on the hospital as well as on you. So this knowledge of these areas is a must for our own functioning smoothly and taking subsequently the departments or the areas in that direction. Because these are not the things, why I'm saying this is because our eyes, whatever they are seeing or doing in the daily things in front of us are what we think is important. However, if there is a fire norm which is broken down, or a consumer protection act which is violated, or a medical negligence which has happened, or a biomedical waste not disposed appropriately, all these are potential legal issues, and we are directly vulnerable, and understanding towards it is very important. And if that be so, maybe everyone may not have that. If I have got the understanding, fine, as an administrator. I want to work on this direction by biomedical waste should be fine in the hospital, or infection control should be fine. But everybody does not have the focus towards that because he's more bothered as a nephrologist कि मेरे dialysis कितने हुए एक दिन में.